understanding the principles of infection control and prevention in phlebotomy. In healthcare settings, infection control is necessary to prevent the spread of diseases during medical procedures like phlebotomy. This video highlights the crucial role of infection control in phlebotomy as well as its key principles. Infection control covers measures to reduce the risk of pathogen transmission between patients, healthcare workers, and the environment. Effective infection control is important in phlebotomy as it maintains patient safety and improves overall healthcare outcomes. It also prevents healthcare-associated infections and ensures healthcare workers' safety. The key principles of infection control include hand hygiene, personal protective equipment, environmental control, sterilization and disinfection, and safe injection practices. The single most important measure in infection control is hand hygiene. Washing hands before and after every patient contact is essential. This should also be done before and after wearing gloves and whenever you are in contact with contaminated surfaces. Personal protective equipment such as gloves, gowns, masks, and eye protection act as a barrier against germs. The type of PPE a phlebotomist needs depends on procedure and the potential exposure risk. Maintaining environmental control through regular cleaning and disinfecting surfaces reduces pathogens that cause infection in clinical settings. Healthcare facilities have specific guidelines for sterilization and disinfection to ensure all reusable equipment and surfaces are germ-free. Safe injection practices prevent the transmission of bloodborne pathogens. Single-use needles and syringes help avoid cross-contamination. In phlebotomy, there are certain transmission risks like being in direct contact with body fluids, improper handling or disposal of sharps, or lack of adherence to standard precautions. These transmission risks can lead to highs and bloodborne pathogen transmission, and that is why standard precautions are necessary. The pre-phlebotomy procedural practices for infection control include patient assessment and screening, taking precautions, educating patients and taking their informed consent. During phlebotomy, using techniques for safe venipuncture and reducing exposure to body fluids is paramount. Post-procedural practices include proper disposal of sharps and hazardous waste and disinfecting equipment and surfaces. Documentation including patient information, procedure details, and record of infection control measures is the key to ensuring compliance with regulations and maintaining patient safety. The NHS has set clear guidelines to prevent the infection spread during medical practices. Following NHS standard infection control precautions during phlebotomy and other procedures ensure consistent, high-quality care across healthcare settings. By prioritizing infection control, phlebotomists can protect themselves, their patients, and the healthcare environment. Remember, consistent adherence to these principles is the key to safe and effective phlebotomy practice.